Hey, this is Paul with Jones Physical Therapy. Today I want to talk about what the role of physical therapy is amongst all of the options that you have when you're trying to treat back or neck pain. And the truth is there are a lot of options now. Back in the day it used to be surgery or nothing, and now there's a lot of things you can do. There's a lot of different types of surgeries. Surgeries are much more sophisticated now, they're less invasive. And there are a lot of things you can do in between, like shots, rhizotomies, things of that nature. And there's also a lot of other things like chiropractic, massage therapy. And I'd like to talk today about where physical therapy fits in that spectrum of options that you have. So if you're having back pain, maybe you've had it for a while and you're not sure what to do, you need to make a choice, and you're looking to make a choice of where do I want to spend my time and money, what's a good option for me that's going to get the best results. And so a lot of options in back care are where they're so-called passive options, where you have things done to you. So you go have a surgery, you go have a shot, you get a manipulation, something like that. The difference with physical therapy is we try to teach people, first of all, what are the things that are influencing their back pain in a negative way. So maybe you have too much weight, or maybe you are not exercising enough, or perhaps the type of work that you do is deleterious to your health. And we try to eliminate those things or modify those things, but then we also try to teach you things that you can do that can actually influence your pain to get better. So this might be stretches, it might be exercise, it might be personal habits, and all these things kind of add up to turning you from the direction of where you're going in a painful direction, we're turning you towards a pain-free direction. And the difference with physical therapy and other options is that we give you the control. We teach you the technology you need to know and the techniques that will get you better. And that, for somebody who's in pain, that gives them a lot of I guess you call it like self-control. They have control over their pain, and that in itself reduces pain because there's less of an emotional component with pain. If you understand, okay, if I do this, my pain will get better, then you don't worry about it so much. And when you have a little bit of pain, you're not thinking, oh my God, it's going to become a horrible amount of pain. I'm not going to be able to work tomorrow, or I'm not going to be able to run after the kids or whatever. And so physical therapy, that's really the difference with physical therapy, is we are trying to teach you how to do the things on your own. Ultimately, we'll start you off with a physical therapist, and the physical therapist will teach you these things, and then ultimately we'll give you things to do at home, like a home program, and different techniques you can use that are going to make you independent in controlling your own pain. So if you are having pain and you're not sure where to start, best thing to do is just come in and talk to a physical therapist. At my office, we do discovery visits. They're basically about a 30-minute appointment. There's no paperwork, there's no charge, and you get to sit down with a therapist and tell them what's going on, how your problem's affecting your life, and then you can sit down with that therapist and make a decision about what's the best direction to go. And it may not be physical therapy, it may be something else, but at least you'll have an expert guiding you to make the right decision. So if you're having a problem like that, if that sounds like you, then give my office a call, and let's get you set up and maybe get you at least on the first step on your road to recovery.